When it comes to looking your best, is there really a right time for a facelift? Some experts say don't even think about it until after other cosmetic procedures, but others may argue it's the first thing you should do. So who's right? And could waiting actually age you faster than acting now? After you've had a facelift, are you completely done? Today, we're breaking down the real risks and rewards of putting off the ultimate anti-aging procedure. Get ready to uncover the insider secrets cosmetic surgeons don't always talk about and decide for yourself if it's worth the wait. Stick around because by the end of this episode, you might just rethink your entire cosmetic timeline.
Welcome to The Doc Dudes, your premier podcast for a behind-the-scenes look at the latest in aesthetic medicine. Hosted by the cosmetic surgeons at Graper Harper Cosmetic Surgery in Charlotte, North Carolina, The Doc Dudes brings you interviews with insightful guests, expert tips from experienced medical professionals, and lots of laughs along the way. And now, here's Dr. Garrett Harper, Dr. Robert Graper, and Dr. Evan Zug, also known as The Doc Dudes.
Welcome to a new episode 13, dun dun dun, of Doc Dudes. This is entitled Facelift Cosmetic Procedures, Saving the Best for Last? ? Let me introduce who we've got. I am Garrett Harper, plastic surgeon at Graper Harper Cosmetic Surgery. I have at the round table, the oval table, the Moval table, kind of modified oval. I've got Dr. Zug, plastic surgeon. Say hello, Dr. Zug.
Hello, everyone.
I've got Dr. Robert Graper.
Good afternoon.
Good afternoon. I've got Linda Owens, who is an aesthetic injector and Allergan Medical Institute national educator and trainer, which is a big deal. I think if you've listened to any of our podcasts, you know how much we love talking about how lauded Linda Owens is throughout the country, and that the people who make the majority of the hyaluronic acid fillers and Botox that we use in our office think so highly of her that they send her all over the place to teach people, including physicians, how to use their products and how to get great results. So really great to have her. And we have Melissa Myers, who is one of our medical aestheticians and the ThermiVa specialist, which I don't know if we're talking about today, but it's kind of cool. So say hello, ladies.
Hello. Hey there.
Hey there. In any event, today we're going to talk about cosmetic facelift procedures and really how we combine skincare and injectables, both before and after, or how we kind of look at the whole process in order to help our patients get the best results. So this isn't so much about like the facelift procedures or kind of how they're done or comparing different techniques or anything like that. It's really talking about, hey, I'm thinking I want to look younger. The face is a great place to start. Everybody's going to look at it. You can cover up your chest. You can cover up your tummy. You can't really cover up your face all the time, I guess, unless you live in Doha or Dubai or one of those places where I went last summer, which was a lot of fun. But this is going to be kind of a way where how to be all-inclusive to get the absolute best results. So we have introduced everybody. I'm going to have Dr. Robert Graper, who really is kind of the main surgeon here that does facelift, neck lift procedures. We all do them, but, you know, he's the senior guy and the oldest guy, so he's going to
Yes, I am the oldest.
That's right.
Undisputed oldest.
That's right. The most esteemed. And so define a facelift for us. Like, just kind of tell us your philosophy. I don't think we need to get into anatomical stuff or any of that. I think we've done podcasts on that before, but just basically what a facelift is, and then what does it do for the patient and what does it not do? Like, what are the limitations of a facelift?
Well, facelifts improve the appearance of the face. That's not the brow. That's not the eyes. It's the cheeks, the nasolabial fold, that line that goes down from your nose to your mouth, and the jowls, and then the neck. That's included in the facelift.
Can you define for me when people ask questions like, what's a facelift? What's a lower facelift? What's a neck lift? What are the differences in those three? If somebody comes in and says, I want a facelift, and you're like, no, you just need a neck lift, or vice versa. Like, how do you kind of define the anatomy there? What addresses what?
A neck lift gets your neck, but it doesn't get your face. A facelift does get your face, but it also gets your neck. And The way I talk about it, if you're only doing your face and not doing your neck, I call that a mini facelift.
Gotcha.
You could call it a lower facelift. Some people might say that, but to me, lower face, does that include the neck? So we just call it a mini.
Is the incision any different for those patients? Like, they're just doing their neck? Is it a shorter incision? Is it something that they don't?
When you're not removing skin from the face and the direction of pull is kind of straight back along the jawline rather than obliquely up over the jawline, you don't develop as much extra skin in the cheek and sideburn area with a neck lift, so you don't have to have a little horizontal incision under your sideburn. We used to do incision in the temporal area, but the sideburn would go up an inch or two because you got too much skin. It's a dead giveaway for a facelift, and it looks weird.
Yeah.
So we now start putting that dart in there right under the sideburn. Heals fantastic. That isn't needed for neck lifts because you're not removing a lot of skin in the face.
Sure.
But otherwise, the incisions are the same. They go from the upper part of the ear or the ear cheek junction around the backside of the ear and then down the hairline or maybe into the hairline and the mastoid area, depending on how high that hairline is and the angle that it comes off just to maintain good blood supply to those skin flaps.
So the way I kind of look at it is, Evan, you do a ton of breast and body work here is kind of when people ask questions like about a mini or a full tummy tuck, right? So it's like we use that line, the belly button, the umbilicus is kind of our line of dissection, right? So it's kind of similar in that a facelift is going to do the whole tummy as like, when we talk about full tummies,
right.
And a neck lift is, if it stops at the jaw, it's going to stop kind of at the belly button.
A lot of people come in and their neck really has got more advanced aging and the face isn't too bad.
Yeah.
And some of those will pick just to do the neck. And then some others will advise to at least think about doing the face because you're doing it all right now. And the incisions are basically the same. The recovery is exactly the same. The cost is less because you got one facility fee and one anesthesia fee, and you look good.
Yeah.
Otherwise, if you say, I'm just going to do the neck, it's not uncommon for them to come back in 5 years, as an example. Now they got to do the mini face.
Right.
Well, I want them to have at least thought about these issues. And some strategically will say, nope, my neck's what bothers me. That's what I'm going to fix. Fine. They're comfortable.
Right.
Others will go, hadn't thought of that. Glad you mentioned it. Because I think I will do the whole face so I don't have to come back in 5 years.
Yeah. So, Melissa, I think this is a great opportunity to get your opinion on this because he kind of brought up, a lot of people's faces may look better kept than their necks because I think people probably take care of their faces and kind of at the fault of not paying attention to their neck. There's so many people that come in that are obviously doing skincare routines to their face. That's what they wash, but not many people are using the product like the neck defirms and things like that to try to help with the skin. So what are some things that people can do, just to take better care of their skin, both pre and post facelifts, as well as their necks?
Gotcha. I think we ladies, normally we look in the mirror, we see our face, and that's all we see. We don't look down the neck. We don't see those red blotches, those brown spots. We don't look at our cougar chest. I saw that on the internet. Horrifying.
Right.
You guys do some great breasts, and if these women have crunchy skin on their chest, that is not a pretty look, so we can help that too. Skin is skin, all of your body. We can treat everything, and I like to get people on a protocol. I like in skincare, clinical skincare, to an exercise regimen for your skin. Yeah. Before, during, after is something you'll do for the rest of your life, and it improves the look. People are going to see that glowy skin. You just look younger, and it pops. It makes you guys' work look way better because you guys are given a brand new mattress. What are you going to do with that old dusty duvet cover?
Yeah.
We're going to fix it.
That's a great analogy because I think sometimes, people... sometimes you can see an absolute line of demarcation, right, of where they are treating things or where they have had treatments. Even when we talk about laser treatments, RF microneedling treatments, any of those types of things, a lot of times people don't, hey, let's go ahead and treat the neck, let's treat the décolleté, let's do all these areas because all of that you really see. Nobody's running around in a turtleneck unless you're Steve Jobs, right?
Yeah, Dr. Graper calls that the pretty zone, from the top of your forehead to your nipple line.
There There
It
you
is
go.
the pretty
That's,
zone.
That is
you
the
want it to look lovely.
That's exactly right. That's excellent. Okay, so a common question that comes up, and I don't think it's like an age thing because people age at different rates, right? I mean, all of us in the room will age differently depending upon genetics, depending upon our habits, depending upon our skincare and our injectables and Botox and things like that, because that goes into aging skin as well that people don't realize. So I don't think it's so much a, hey, at what age do I get a facelift, Dr. Graper? But like, at what point do you start to think about a facelift? I would argue, not trying to put anything in your mind, but I would argue when it starts to bother you. That's what I tell people.
I think that's exactly right.
Yeah.
You know, and some people it doesn't bother them till way after they should have thinking about it.
When it's too late.
Yeah, I mean, I would say everybody, even in your 20s, sunscreen for sure, starting on a retinol, starting on an antioxidant, and then let the estheticians advise you in your individual situation. You know, Botox and fillers, when you know, Linda can talk about, do you do it before you get the crease or do you do it after you get the crease? And, you know, when the volume issues start showing up, or do you preemptively do that? But you get going early on all these things, and then when you notice you have a problem, do it when you're looking at pictures and you don't like them. Right. Some of those people are in their 40s, some are in their 70s. Yeah. Some people say, I want to wait till I see a real big difference when I do it. And other people say, I don't want to ever look bad.
Right.
So when I notice it, I want to do it. And I don't want my friends ever to see me where I don't look my best.
Yeah.
And an earlier facelift does last longer. And you say, well, why is that? It's because the tissues are better. You know, your tissues in your 50s are much stronger and able to hold the pull we put than your tissues are in the 70s when they can't hold it as long.
Yeah, I always get a little sad too when patients kind of talk about, oh, I've been thinking about doing this for, 15, 20 years. It's bothered me, but I was just too young to get it. And you're like, oh my gosh.
You could look much better for all those years.
For like all these years, and it's been bothering you. So Linda brings it up because he brings it up to you. Like, where does Botox and filler kind of come into play, not only with skincare, right? Because we know that Botox and filler, the neurotoxins and the hyaluronic acids, we know that they're synergistic with each other, but they also play a role in helping the skincare, the estheticians, do the best job with your skin. There's also a newer product out that helps kind of hydrate the skin. So you can talk a little bit about that. But, I imagine if somebody was getting ready to do neck and facelift in 4 months, what are you telling them? What shouldn't they do? What should they do? When's a point where you're just like, you know what? Let's do your surgery and then let's kind of circle back around. And when should they circle back around after that? Because I remember, a lot of times there was this advent where people were fat grafting at the time of facelifts, right? And just kind of, it looked so kind of not specific. It looked just like people were harvesting fat from the belly and then they were just kind of squirting it down there and then you didn't really know what was going to survive and what wasn't. So I've told my patients, I think getting your own body's natural structure that was there into position does a really great job for kind of setting you up with being able to use filler and Botox to then kind of supplement the procedure. So what's your philosophy on that?
Well, of course, Botox and fillers are both designed to keep us looking youthful. And, let's face it, whether it's skincare, injectables, or surgery, no one wants to look funny, weird, done, or distracting. And we're not in the business for that. We just want to stay pretty. But really, these modalities are designed just to, for instance, Botox weakens the muscles. And so it's going to prevent the frown lines, the creases, the permanent horizontal lines on the forehead and the crow's feet. And so after a facelift, do you still need Botox? Absolutely, because your facelift removed that excess skin, but it didn't stop your muscle contractions. As far as fillers, just like you said with fat grafts, the fillers are going to reestablish the fat pads that have gotten smaller and that have descended. And so with the Juvederm Voluma, we're going to lift a little bit. It's not a facelift. We did a cute post, Dr. Graper and I did a picture of liquid facelift versus surgical facelift. And a liquid facelift is a combination of Botox to soften the lines and wrinkles in upper face, Juvederm in the mid and lower face to camouflage the jowling and to lift the cheeks. They're two different things. After your facelift, you're not going to stop getting your filler. Of course, you're not going to need to treat the pre-jowl sulcus because you removed that jowling. I know. You just did mine for me, and I'm loving it. And so those things don't stop. In the skincare, injectables and facelift, this all complements each other.
Right.
It's not choose one or the other. And as far as the time to when it's time to have this done, for me, at 61 and a half is when I had my facelift. I did it because I want to look and be the best version of myself always. I want to present well. I'm going to be working for,
20, 30 more years.
20, 30 more years.
Yeah, exactly.
I want to look as good as I can for my age. And I feel like each of us, when a patient comes in, we're going to help direct them and advise them and help them with that choice and decision on when it's time for them to have skincare, injectables, facelift. I think we're all pretty good at directing our patients and helping with that choice.
Yeah, 100%. I think that what the estheticians do with skincare and what you do with filler and neurotoxins will only make the result from the facelift last longer, right? And it'll kind of it's upkeep. It's like what I hate to hear from anybody. Evan, I don't know if you ever have a patient, I'm sure you do, that come in and say, "Oh, I can't wait to get my breasts lifted. I never want to have to wear a bra again." I mean, I'm sure that makes you all excited when they say that, right?
Yeah.
Yeah.
First question is, when can I stop wearing my bra?
Yeah.
When do you want to be back? Because that sounds good to me.
That's exactly right. Yeah, I'm like, well, I guess when God eliminates gravity, we won't have to worry about it. But until that time, let's take care of things. And so it's the same, right, with the face. The face is exposed to all the elements, right? Sun, wind, all those things. So it's really an area that I think we concentrate more on because it is always presentable. And when you say you want to present your best version of yourself, everybody talks about their face, right? Which is hugely important. Now, one thing that I think I've got a couple of reasons why when anyone comes in for a facelift, neck lift consult, why I say, okay, are you on a skincare regimen? And if they say, no, I just kind of wash with Dove soap or something like that, I'm like, all right, I want you to see my esthetician. So I say, well, there's a couple reasons for it. One is I want to get your skin as healthy as possible. I want it to look as great as it can because I think that it's only going to make your result that much prettier. I also think that it really helps patients understand what the regimen is going to look like afterwards. Right. And so it's really in that kind of post-surgical time, I think sometimes you look so great that you're just kind of like, I don't have to go back to that. Look how good I look. I look 10, 15, 20 years younger. I don't need to do any of those, upkeeps or regimens. And so I think that it's one of these things where once it becomes a daily routine for patients and they can see the improvement in the way they look prior to surgery, they're like, oh, hell yeah. Like I'm going to continue to do this to make it last longer and continue to look this great.
The quality of the skin.
Right.
Like you've taken care of the quantity, the excess skin, you've
Exactly.
removed it. It's in the biohazard container.
Yeah.
But we're taking care of the quality of that skin, and it just looks glowy.
Well, think of the furniture analogy. If you got a piece of furniture with one coat of varnish on it, it looks okay. If you get it with 10 coats of varnish, the translucence, the depth is just much better.
Right.
And it's the same way with skin. To get all the colors the same, get the textures the same, and pretty small pores, it just makes anything we do look better. And I think Melissa mentioned earlier, it's like exercise. You look better working out every day than you do doing one marathon a year. So exercise in the skincare world is daily skincare. The marathon is I'm going to come in and do a laser. Mm-hmm. Well, you're better working out every day, skincare every day. And if you want to run a marathon too, great. That's even better.
We
but
can help you
the
come in
most
first.
important is the daily stuff.
And what kind of begs the question, Melissa, so if somebody does come in and say, I don't really have a skincare regimen, but I really want to do this facelift. How much time do you need, do you think? And it can change. It can vary, right? Some people can come in and just genetically they've got beautiful skin and great. So I don't think the answer is like 38 days. But like, what's a general gestalt that people should kind of anticipate saying like, you know what, if we're really going to tee this up for Dr. Graper and Dr. Zug and Dr. Harper to get the best result possible back in the operating room, let's spend this range of time together. What do you think?
Now, yeah, for a facelift, it's a little bit different because we're not trying to prep the skin for any kind of removal, like it's topical removal. Yeah. When he does his TCA peels and his crotonol peels, we most definitely want to get a hold of that skin at a minimum. I like a minimum of 6 weeks to get them prepped.
Sure.
If someone comes into the office and they, like you said, have been using Dove soap.
Better than Irish Spring, right? It's
Oh,
be better
goodness
than Irish
gracious,
Spring.
yeah.
What's the stuff that's got the wax in? Is that CeraVe?
I mean, there are so many things over the counter. So many things. It makes you feel good. Your skin feels so good, but it has a wax coating. When I get the wood slamp on, it looks like you have a ghost mask on. So you have put wax on your face.
And it blocks the pores?
It does. Well, it blocks the pores. It blocks absorption of any kind of bioactive that we're going to give you to improve the cellular quality of your skin. So this is all on science. You can buy things over the counter and it makes you feel good, but if it's not acting on a cell and changing something about that cell, it's not doing diddly squat. Yeah. So you're going to get in, I'm going to give you, and typically if you've never done anything at home, I'm going to keep you simple unless you're getting the big kahuna with Dr. Graper, the peels. Yeah. But I'm going to start them off on something to wash that's not going to keep wax layers building on their skin. I'm going to give them an antioxidant. That is your bodyguard. That's going to protect the integrity of the existing cells and newly formed cells. And then I'm going to give them some kind of regenerator. Retinols, Dr. Graper is a huge fan of retinols, and that's the gold standard. But we have so many other things as well we can incorporate, but keep it simple. Yeah. We want your skin to get healthy. 6 weeks, I love if I have more, if they really need it, depending upon the damage. But again, it just depends upon the procedure they're getting. Yeah. But we want to customize that for the patient.
Yeah, one kind of key thing when you said keep it simple, I think of like male patients, right? Because you've done a fair number of male facelifts recently. And I think that, if you don't keep it simple and like,
you lose them.
A guy is not going to follow a 7-step process.
No,
you know what I mean? It's just not going to do it.
Yeah, keep it simple.
All right. And then another question always kind of comes up, right? These patients, they talk about their face or their neck or anything like that, and then they talk about combining it with other procedures. Is it safe to combine with other procedures? So do you have a philosophy on that, Dr. Graper?
As long as it's safe.
Sure. To define that as being safe.
If you had an adverse outcome in one area, it wouldn't affect the other area.
Right.
The adverse outcomes need to be very small anyway, and they are.
Right.
You and I have done a number of breast and face procedures or body and face procedures, and we certainly do eyelids and brow lifts at the same time we do facelifts. You could do liposuction. It's got to be safe in the operating room. It's got to be safe post-op. The recovery of one surgery can't adversely affect the recovery of another procedure.
Right. And then what about combining surgery with procedures, right? What about combining the patient? Like, do you ever do peels or laser treatments or RF microneedling or injectables or any of that at the time of a facelift?
I have not, because I am concerned about safety. If you're undermining the skin with a facelift and then you're attacking it, it changes its blood supply, and then you attack the outside with a chemical peel, I think your chances of getting a full thickness injury, i.e. burn, go up.
Yeah.
So therefore you have to make the peel so much lighter, and then is it really doing anything?
Right.
And it's, adds cost and risk, and so I'd rather do them in 2 stages so they get the best result for both of those procedures rather than any compromise.
Yeah. And then what about the importance of establishing realistic expectations from a facelift standpoint, from a skincare standpoint, and from an aesthetic injectable standpoint? I think obviously we always want to try to set expectations with patients. And I think oftentimes patients say things like, well, how many years younger? And kind of hard if you hadn't known the patient for a long time. You don't know what they looked like 10 years ago or 5 years ago. I mean, heck, they may have looked 60 years old since they were 25. So who knows? But like, what's a way to help kind of gauge? I mean, obviously from a surgical standpoint, I feel like when we're in consultations, we can have the patient hold a mirror and we can actually kind of push up on their skin and wrap it around their neck and their jawline and kind of imitate what it's going to look like, right? It's probably a little bit harder, in the aesthetic injectable or the skincare line. So Linda, like what kind of tools, what can you tell patients where, because you want to have that perfect sweet spot where patients don't overdo it, but don't underdo it to where they think like, oh, filler doesn't work on me. Like, no, filler works on you.
It does.
You just didn't do the right amount.
Right. And a lot of people, truthfully, are just a little nervous when they hear the word filler because we've all seen good cheeks and good lips gone bad. Yep. And we're not in the business for making people look like that. And so I like to educate patients and let them know there's only a fifth of a teaspoon of filler in a syringe. So literally we can do 4 or 5 syringes in one sitting. You're still walking out with a teaspoon of product. But
and for the men out there, the teaspoon is the smaller spoon, correct?
It's
not the tablespoon.
It's not that soup spoon.
It's the small one.
It's that little small one.
It's not my clam chowder.
Nope.
Yep.
It's a small one.
Yeah, the ladle. That's what I use.
We don't have to do it all in one sitting. I'm going to be here. I like for them to come in. Let's do a little at a time. Let's start with just 2 or 3 syringes. And you need at least 2 to see a difference in any given area, whether it's the mid face or the lower face. Literally, you do need.
And those are larger volume areas than, say, like the lips or
correct.
Tear
Lips,
troughs
we're only going
like
to start with 1 syringe. Tear troughs, with 1 syringe. And it's.
And there are different fillers for different areas of the body, correct?
There are. We use. I typically use the Juvederm products because in my Juvederm toolbox, I have 6 different products that are all FDA approved for specific areas on the face.
Right.
And you also mentioned SkinVive. That's the 7th product. It's not a filler, but it's literally the first and ever only FDA approved injectable moisturizer. So it's little micro droplets of hyaluronic acid that's injected. And that's
injected in the skin.
It's injected into the skin. It works on the aquaporins, the little proteins that bring hydration to the skin. And It just makes your skin look pretty and healthy and hydrated.
For how long?
For FDA approved for 6 months.
Okay.
So most people are going about 6 months. We can do a little top off at about 3 months, but I've got a lot of patients who it's 9 months out now and they're still enjoying that glow.
Right. And so for the particular areas of the face, I know it's dependent upon which filler you're using, which you use fillers depending upon what area of the face you are actually addressing. What's the rough timeline of when patients are going to come back and see you for touch-ups or, hey, it's all gone, I need more? I mean, what do you do? There's not like, it's not like it lasts for a year, you look the same for that year, and then at day 366, all of a sudden you're back to where you were at day 0.
It's personal preference, but Botox is FDA approved to last for 3 to 4 months. So on average, most people come in about 3 times a year, which is every 4 months for their Botox. There are some people who come in right at 3 months because they do start to see that movement and they've got parties coming up. So that's personal preference when they want to come in. The fillers are FDA approved to last anywhere from 12 to 24 months. And so I would say from my experience, most people at about a year or about every 3rd time they're in for their Botox, they're ready for a little top off of their filler. But I like to assess and talk with them each time they come in and have a plan for the next treatment.
Awesome. And so, Melissa, for you, your best patients, if you could just say, you know what, money's no object. This is how often you want to see them for dermaplaning, for touch-ups, for facials, any of that. What's a great relationship to have with your esthetician? And obviously we know daily and nightly skincare, but how often should they be coming in to see Melissa Myers?
They're going to come visit us every 4 to 6 weeks. We're going to keep them on as close to a cycle of cell development and exfoliation as we can possibly manage. So yeah, it's every 4 to 6 weeks. If you want to keep your skin in optimal condition and even make gains, please come in.
Love it. Well, I think that the general kind of theme, and I think probably philosophy of the practice is that all of these things, right? Skincare, surgery, and injectables work in concert together. And there is a timing process for all of this. And I think for patients, the big key here is, surgery is an option for you when it starts to bother you. Now, that doesn't mean that we're not going to have somebody that comes in that we just say, that shouldn't bother you. Like, you look great, you don't need it. I mean, certainly I feel like as we've gotten further along in our careers, there's probably more patients that we turn down now than maybe there were, 20 years ago, 10 years ago. But certainly I think we've gotten to the point where we know that those patients aren't going to get the result that they need. And so when somebody comes at, and I hate to throw an age, but when they come to a point where surgery is not going to benefit them to where we think they're going to really see a difference, I think our technology is so amazing, bridging those patients with skincare regimens, skincare procedures, the RF microneedling, the lasers, Halo, even Renuvion, which is something that we have new in the office now. All these things are great options to bridge those patients. But I mean, ultimately, we always like to say we're not the breast police and we're not the face police either, right? Like when somebody starts to say, I hate my turkey neck, I don't like it. And we're like, really? Like, your neck looks better than mine. Well, maybe they want to look better than you, Garrett. And so it's kind of up to them, So I think, all just like every patient that we have that we see for any procedures here, it's tailored to the patient. And it's really kind of dependent upon identifying that they have a problem. Dr. Graper said this since day one, right? Identifying that you have a definable problem that we have a solution for. Get the diagnosis, get the prescription, and if the prescription is skincare, surgery, injectables, or a combination of those three things, thankfully we're under one roof where we can treat all those things, which is pretty great. So those are our kind of closing thoughts. If you have questions or topics you'd like for us to cover, visit ghsurgery.com. Click on the Doc Dudes from the homepage. There's a link to click to submit your questions and ideas. You can also listen to all the Doc Dude episodes on our website, as well as Apple, Spotify, YouTube, or really anywhere you listen to your favorite podcast. So if my dad's listening, since I was talking to him on my way over here, he's like, how do I plug into it today when you're recording these podcasts? I was like, that's not how it works, Dad. I was like, you just go to the little podcast icon on your phone and then search the Doc Dudes and we'll be on there. Also follow us on Instagram and Facebook to find out when new episodes drop and other information about our practice. We appreciate you being with us for episode 13, Facelift Cosmetic Procedures, saving the best for last. We hope that we addressed a lot of your questions. If you have any others, feel free to contact us, come in for a consultation. But thank you to Dr. Zug, Dr. Graper, Melissa Myers, and Linda Owens. This is Garrett Harper saying bye, and the doorbell just rang. Bye.